Hello everyone, my name is Olawumi Olokode and I'm thrilled to be here with you today. I want to start by expressing my gratitude to CiAY Pathways Youth Foundation for inviting me to speak at this significant event. This annual 30-day career boost initiative is mind blowing, and the work that they're doing is really, applaudable because not many people come together to bring this kind of initiative for youth and by youth. So it's a powerful platform, and I want to encourage you that everything you learn on this platform, you make it worthwhile because trust me, it is premium, it is quality, it is all that you need for your career progression and getting clarity with all that you need to do. And so it's a powerful platform. I want to say thank you to Mr. Adeyinka for following me up and for making this a reality. So, without wasting much of your time, today we're going to be exploring a topic that is incredibly important, not just for healthcare workers or professionals, but for every single person. And the topic is universal healthcare, a realistic goal for global health equity. So, we're talking about global health equity. What exactly are we talking about? And this subject is one that affects every single person all around the world. And so it addresses the fundamental right of every human being. And what is this fundamental right that I'm talking about? This fundamental right is the right to healthcare, regardless of circumstance, socioeconomic status, finances, gender, whatsoever it might be. We want to make sure that they have access to healthcare. Now, what is equity? In this context, equity simply means fairness, justness, justice, whatever it is you call it. But making sure that everybody has the same access to the same set of things. Let's start by defining what I mean by universal healthcare or UHC. UHC is the idea that everyone, everywhere, should have access to the health services that they need, when, where, and however they need the health services. And financial capabilities should not stand in the way of the ability to access this health care. Now, this includes a range of services. It includes preventive care to stop diseases before they start, curative services to treat illnesses, then rehabilitative services to help those recovering from serious conditions. And as well, we have palliative care that provides comfort to those who have life-threatening illnesses that has no cure. And so we want to manage them to ensure that they pass on without pain and in the best form possible. According to the WHO, that is the World Health Organization, the UHC was one of the targets set by the nations of the world when they adopted the 2030 Sustainable Development Goals in 2015. The countries reaffirmed that health is a precondition for and an outcome, an indicator of the social, economic, and environmental dimensions of sustainable development. The way you know that a country is actually doing well is when its citizens are healthy. And when the citizens are healthy, they are able to go about their work, thus bringing in more economy, increasing and enlarging the economy. And of course, they're able to tend to their environment because they are at the right frame of body and of the mind also. So universal health coverage is something that is very, very important. No wonder the nations, when they gathered, United Nations, brought it into the very core of the Sustainable Development Goals. The world is actually off track to make significant progress towards universal health coverage. This is why this topic at the moment is very vital because everybody is needed to facilitate the implementation of universal health coverage. And although improvements has been happening here and there, but in 2015, There has been a stagnation that has occurred, and majorly it's because of the financial status of many countries and, of course, of individuals in those countries. And because of that, out of pocket health has increased. People, when they want to have their care, they end up spending the money they have at hand rather than having access to whatever service like this health coverage that the government can make available for them. And this pattern is been consistent across all regions and all countries. So nobody is exempted from this catastrophe. Another statistic given by the World Health Organization is that about 2 billion people are facing financial hardship, including 1 billion of them experiencing catastrophic out of pocket health spending. And about 344 million people are going deeper into extreme poverty due to health costs. Do you see why this topic is very essential? Because if people cannot afford to take care of their health, then it's as good as the world is crumbling before our very eyes. And that is why something must be done about it fast. Now, I want you to imagine a world where no one has to choose between paying for their health care and putting food on the table. That is the vision behind the universal health care coverage. And it has been very challenging, but you see, no matter what the circumstances might look like, it is very possible. Why is universal health care coverage so crucial for global equity? I told you earlier that equity in this context means fairness. It is about ensuring that everyone has the same opportunities to achieve their health potential, regardless of their social, economic, or geographical background. But sadly, the reality is that millions of people around the world do not have access to even the most basic health services. And this inequity is linked to poverty, discrimination, and weak health system. I personally experienced patients coming to the hospital having not a dime. Some of them want to put to bed, and the woman has been pregnant for 9 months, and they still do not have anything to take care of a baby and even go ahead with the delivery process. Thank God I work in a public hospital where even when these kinds of things happen, there are systems in place to ensure that the patient has access to immediate care such that they would be salvaged, their healthcare system or their healthcare condition will be salvaged firstly. Afterwards, they would then still go ahead to pay out of pocket. Even though here and there they're trying to cut down the cost, but you see, it is still not complete. But now imagine a place where this is not existent at all. Then you must know that it is a serious and a very crucial thing to address. Now, universal health care coverage can change that, can change these kinds of things, whereby it would ensure that everybody everywhere can access health services without having to be buoyant financially. So the universal health care coverage is a powerful tool to reduce health disparities and promote fairness. And so when we talk about global equity, we want a level playing field everywhere in the world where no one is discriminated and they have the opportunity to live a healthy life. That way, they can even give a shot at becoming, at climbing the ladder in their finances, in their social life, and with everything else they want to achieve in their lives. Talking about universal healthcare sounds very inspiring and looks like what the world needs, but you would agree with me that such a vision, achieving it on a global scale, comes with its own challenges. Like I told you earlier, since 2015, the progress has been really slow. And so I'm going to be talking about a few challenges that faces universal healthcare and what can be done about it. There are majorly three challenges. The first is the financial challenge, the second is a political challenge, while the third is a challenge with developing formidable healthcare systems that can ensure that this service or this vision is properly executed. So, very quickly, let's talk about the first challenge. First, the financial challenge is a very crucial one because it looks as if it's the major problem, even though all these challenges are interwoven. One is not more important than the other, and you will see why I'm saying that. However, the financial challenge is the most obvious, the most glaring, what everybody can see and what everybody sees as the problem. So, in implementing universal healthcare, there's a need for significant investment in healthcare infrastructure, workforce, services, just like as technology advances, all of the research that is carried out gets done because of massive financial investment. All the trials and the errors, all of these things cost money. And so many low income and middle income countries struggle with limited financial resources, and they have competing priorities. People think that if we don't have food in our stomach, how can we be pursuing healthcare? Or if you're trying to achieve this and that, how can universal healthcare coverage be what we are thinking about? So usually for these countries, funding a project like universal health care can look like an irrelevant thing. Secondly, there are political challenges that stand in the way of the implementation of universal healthcare coverage. And healthcare is often a politically sensitive issue. In some countries, there may be resistance from powerful interest groups, such as private healthcare providers, who might fear losing profit under a universal system. And additionally, changes in government or policy direction can disrupt a long-term plan for healthcare. So generally, people may just stand up and silently begin to oppose the implementation of this kind of program. And finally, there's a challenge of building strong healthcare systems because even with the best of intentions and sufficient fundings, implementing universal healthcare coverage requires well-trained healthcare professionals, efficient supply chains, and effective management systems. You just don't want to put people in charge of these things that we end up mismanaging it or just turning it all upside down. Many countries, especially in Africa, face shortages of healthcare professionals and lack the infrastructure needed to execute or carry out this plan efficiently. Because of the lack of infrastructure, they are unable to deliver care to everyone at every place. For example, people in the remote areas may not have access to this kind of care because of where they stay. Given these challenges, you might wonder, is universal healthcare a realistic goal? The answer is a resounding yes, but it requires a collective effort from everyone. That is why you are listening to what I'm sharing today, because you also have a role to play in its implementation. It will interest you to know that some countries have already made significant it will interest you to know that some countries have already made significant It will interest you to know that some countries have already made significant strides towards the implementation of universal healthcare coverage. Take Rwanda, for example. After the devastating genocide in the 90s, Rwanda made a remarkable recovery and now has one of the most successful universal healthcare systems in Africa. Through community-based health insurance and strong government commitment, Rwanda has managed to cover over 90% of its population with health services. That's amazing. This example shows us that with a strong leadership, political will, community engagement, and individual collaboration, universal health care is achievable even in the most resource limited settings. However, it is important to note that universal healthcare is not a one-size-fits-all solution. Each country must tailor its approach based on its unique problems. For example, the United Kingdom cannot be funding or pouring money into a malaria program. Places in Africa need that more. And so every country needs to check what is peculiar to their place and begin to provide solutions to those problems. Also, the fact that we all countries do not have access to the same kinds of resources, it is important that everyone can work with what they have to still further push the narrative or the plan for universal healthcare. So it means that while universal healthcare is realistic, the path to achieving it will look different for every nation. Now, let's talk about your role in all of this. What is the role of youth in promoting global health equity? As young people, whether you're in secondary school or tertiary institutions, you are the future leaders, policymakers, healthcare professionals, and advocates who will shape the world health systems. And in fact, some of you are already doing so. We have Gen Zs and millennials that are even in the place of authority and are making decisions every day. Our generation has the power to drive a change, to make a change, to give our voice, to ensure that this cause can be championed so that the boy in the village or the boy in the city can have access to the same kind of healthcare, giving everybody a fair chance at life and at success in whatever they decide to do. Every single person has the power to make a change, and it starts with you. You can start by educating yourself about the issues surrounding global health equity and universal health care. Get involved in community health initiatives, volunteer with organizations that are working to improve healthcare access. Use your voice to advocate for policies that support universal health care. In today's digital age, you can also leverage social media to raise awareness and build movement around these critical issues. All I'm just simply saying is don't sit back and fold your hands and think that some people somewhere will make it happen. Your voice counts. Your voice counts online, offline, in your engagement, and in everything that you dedicate yourself to. That ensures that this initiative or this plan or this system is properly implemented in your locality, in your state, and in your country at large. Remember, the journey to universal healthcare is not just about government, not about big organizations, it's not about every other person. It's firstly about you and me. It's about your passion, your innovation, and your determination to make real difference. And you can do that. And at the end of it all, you see that you can create a fairer and a healthier world for all. If there's anything that can put everybody on a pedestal of equity, it is universal healthcare. Once everybody has access to the same healthcare services, trust me, people's mind will open up. They will begin to produce better, and economy, socially, in every aspect of our lives, they'll be able to function maximally. In conclusion, as you participate in the 30-day Career Boost initiative, I challenge you to think deeply about how you can contribute to the goal of universal healthcare in your communities and beyond. What can you do today to ensure that in the future, everyone has access to the healthcare they need? Think about it. Take out time to brainstorm. What are the little things you can do from time to time? How can you use your education, your skills, and your networks to make a difference? This is what I want to challenge you to do. And I believe that I have smart minds in the building. So ensure that you give this a go, and trust me, your effort makes the difference. Thank you once again to InStrike Pathways Youth Foundation for organizing this event and giving me the opportunity to speak with you today. I am confident that the knowledge and experiences you gain during this 30-day program will empower you to take action in meaningful ways. I wish you all the best in your journey ahead. Together, we can achieve global health equity. It begins with you. Thank you for listening. And if you have any question, feel free to drop it in the comment section. And if you need to reach out to me, my contact details will be made available, and you can personally reach out to me for mentorship, for guidance, and for anything else you need to know concerning your health and you generally. So it's a pleasure having this conversation with you all. Thank you for having me, and have a good evening, good morning, good afternoon, from wherever you're watching in the world. Bye.